Hello, everyone. You're welcome to yet another episode of our COVID-19 webinar series at AWCAA. This has been a consistent webinar that we do every month that is focused on COVID-19. I just want to welcome every one of you. I can see Isaiah, I can see Misha, I can see Omega, I can see V. Parker. We also have our distinguished guest and speaker for today. That's Dr. Dan Fagbuyi. And then we also have Ms. Ife here with us. But then before we start the discussion proper, we're going to have Ms. Ife just introduce the organization to us, and then why we are actually here, and then the project that we're doing that is that's why we're actually doing what we're doing, the webinar, and then we can continue from there. So Ms. Ife, over to you.
Thank you very much, Mr. Chris. This is Ife Waboku, the president for the African Women's Cancer Awareness Association. Today's webinar cannot come at the most opportune time, knowing that we had just thought we're dealing with the Delta variant, and now the only thing that is going on is the Omicron. So we are here to listen to our distinguished speaker today. We are here to learn and try to understand how to stay safe during the holidays. As a people, as Africans, as African-American, as Black people, we love to party. We love the holidays because it gives us time with our families. And so we want to have fun, but at the same time, we're having fun. And also this conversation is worldwide. So for that reason, if you have questions, if there's any way for us to continue this dialogue as a community, we want to do that so that at the end of it all, we know that those who knew, the experts, those who had the knowledge, that they were there guiding us. And we are pleased that the CDC chose us as one of the organizations to be able to go out in the public, in our community, educate the community. And that's what we are doing today. We have a monthly webinar on COVID-19. This is part of it, and hopefully as the year turns and we start a new year, we will continue this discussion to keep our community safe. Thank you very much for all of you who logged in this morning. I know we will leave here glad that that's where we spent our Saturday morning. So I'll turn it over to Mr. Chris, so you can properly introduce our distinguished guest. So thank you.
Thank you very much, Ms. Ife, for that introduction. I think it's very important that we actually know exactly why we're here. This is a CDC-funded project, and we're glad that we are part of the organizations that are actually serving our community when it comes to helping to increase COVID-19 knowledge, education, as well as encouraging vaccine uptake, in our community. So we're glad that we are doing this. So today we have Dr. Daniel B. Fagbuyi. He's a distinguished ER physician, a war veteran, biodefense, and public health expert. He's the CEO, media contributor, former Chief Medical Officer and Assistant Professor, providing strategic leadership in public health literacy, biodefense, disaster preparedness, emergency management, and business continuity.
Okay, yeah. I think we need to get you back on. It looks like Mr. Chris is frozen for a little bit.
I think he's back on.
He's back on. Okay, Mr. Chris, let's go now.
So Dr. Dan served as Medical Director for Disaster Preparedness at Children's National Health System. He was Assistant Professor of Pediatrics and Emergency Medicine at the George Washington University School of Medicine, where he earned his MD at the age of 25. He's board certified and one of the first and youngest African Americans appointed by the US Secretary of Health and Human Services, Kathleen Sebelius, that's the Obama administration, to the National Biodefense Science Board to provide expert advice and guidance on complex issues of preparing for and responding to adverse health effects of public health emergencies. Served as chairman of Anthrax Vaccine Work Group, HHS, served as special medical advisor to the FDA offices of the Commissioner, Pediatric Therapeutics, Counterterrorism and Emerging Threats on Medical Countermeasures and Drug Approval. This is quite an interesting bio. So as spokesperson / medical expert, Dr. Fagbuyi seeks to empower the public by providing timely, tangible, and easy to digest public health information and education. Appearances in both lay and professional media include the CNN, CNBC, MSNBC, Washington Post, and many others. In his quest to broaden global health education and security, Dr. Fagbuyi provides expert advice and consultation in the US, Japan, Abu Dhabi, Dubai, Qatar, and Africa. His global footprint continues to expand with his role as CEO of Erudition, LLC. Please make welcome Dr. Fagbuyi. The mic is passed over to you, sir.
Thank you so much, Chris. Can you all hear me?
Yes.
Excellent. And thank you, Ms. Iffy. I want to seize the opportunity to thank the African Women's Cancer Association just for having this conversation and then congratulating you on your recent award for the wonderful work that you've done in recognition. So I think that's important in the organization and how you've tried to reach out to the population and the diaspora and addressing some of these health disparities that are within our community. So I'm going to touch on those things and then summarize some of the issues we're dealing with Omicron and how the tools that we all can do to be a part of the solution in this process. So while I get into it, so I'm very candid, so bear with me. My opinions are my own. They do not reflect the government, nor do they reflect the organization of African Women's Cancer Association. So I wanted to say that. So greetings to everyone. I hope everyone, wherever you are, you're doing well and being safe as best as you can. So one of the most important things I think is to highlight is how we got here, what really happened, to try and put this all in context. And then we'll open it up for questions. We'll be able to have some dialogue. The first thing is, how did we get here? So over the years, we've been worried. And when I say we, that means a group of experts who have been in the biodefense and public health space have been worried about if a pandemic occurs or if a terrorist event occurs that affects the population, the public, and how do we actually prepare for that and get ready for that? Many have opined on it. We've published many papers, yours truly, along with others such as Dr. Fauci and others in these rooms having these conversations while everybody else is kind of pretty much moving on with their lives, trying to worry about how they put food on their table, provide for their families, send money back home. You know the routine, the usual and important things that we all need to do. But there were a group of people who were worried about these things. You know, these are events that usually have no notice or that people aren't really looking forward to happening, but you have to prepare for it. How do you take care of the children? How do you take care of the family members? How do you take care of the elderly? How do you take care of the immunocompromised, those who have cancer or underlying medical conditions, who are on chemotherapy or receiving some type of therapy that weakens their immune system and puts them at risk, those who have diabetes and other health situations, chronic medical conditions that can actually make their health outcomes worse. So in that process, there were many guidelines. And then, of course, we know what happened. There were many political issues that resulted in lack of funding, money being taken away or misdirected or directed to a different cause that was purposeful at the time. So these are the politics that sometimes go with these processes. But that notwithstanding, then the virus came, and then we had to deal with it. By the way, we had dealt with certain things such as H1N1, Ebola, all these other things in the past, right? But we kind of say, hey, yeah, this too shall pass, and it goes away, and then we kind of forget. We forget. We don't learn from the experiences, or what I call the re-experienced lessons as opposed to lessons learned. So that's how we got here. Now, how does this relate to right now? Well, there were other issues that we needed to address, and CDC has addressed this. And as a partner with CDC, as this wonderful organization is, you know, there are health disparities that we need to address. So I think there's something that is important to highlight about that. And even before that, there are certain things that have affected different populations, especially Black, Latinx, African diaspora population, and other races that have led to some mistrust and have been fodder for all this misinformation that we'll talk about. So what really happened? Well, there was a violation of trust within the medical community and by the government. Let's call it what it is. Let's not deceive ourselves. Doing unnecessary experiments on people, not having informed consent, all those things are historical context. That is our trauma that we've had to deal with. So now when we're coming to people as providers and healthcare practitioners and saying, hey, it's time to get your vaccine or get this medicine, they kind of look at you funny, like, why should I take this? You haven't looked out for me when I had my diabetes, when I had my cancer, when I had my blood pressure issues. You haven't made those efforts. And now you're telling me to take the vaccine. You'll give it to me free. You'll do all these things. Why? Is there some other reason? And there's reasonable to have doubt. So the key is we have to educate one another on what those issues are and how we've moved forward or how we're addressing those issues. So I think there was a violation of trust. There was also a lack of access to quality healthcare. Healthcare access was difficult. Sometimes you weren't able to get enough insurance to be able to cover certain things. You get denied. Your provider will have to call them. You can't even get to a clinic to be able to get your follow-up, your medication. The bills are expensive. All those things have made health equity an issue. And of course, there were the racial disparities. And what are disparities? It just means basically there was either lack of access or based on the environment in which you grew up, due to the finances, due to the situations. It just wasn't an equal or level playing field. And even having something equal doesn't necessarily mean it's equitable. Meaning, just because you require this set of standards for people, some people need more help. Some people need less help. So you have to have that balance to get them to where they need to be, and also meeting people where they are. So we have to go into the neighborhoods, into the communities, meet them at the grocery store, meet them at their function, at their gathering. It's a birthday celebration. It's a special organization that's meeting this group. It's at church, at mosque. Those types of things. It's a hip hop event, an Afrobeats event. Where are people and where can we meet them? And then the other most important thing, who is the messenger? Who's giving them the message? Does that person look like them, or does that person not look like them? Does that person speak their language? All those things are important with the messaging, because we're not going to believe you. That's just what it is. So these are the things that we have to build on. And how that is relevant for you is how you also perceive that information. When people are providing you with the information, you need to know your source. Isn't an authoritative source, a source who have published in that area, somebody who understands the information in this area, not just your auntie up the street or our uncle on WhatsApp who sent it to us all from all our other countries and sent us a video of somebody being adversely affected by a vaccine, and it's all misinformation. So those are the things we have to also be accountable for in terms of understanding where we get our information from and what our sources are. So those are the things I would say, at least with the background, that has led to some problems with regards to that. Of course, you know, where people work and play also play a factor. So for kids, you know, if they're in a certain neighborhood, they might not have access to certain things, but they also might be at risk of certain things. Where you work, if you're being discriminated against, those also can be traumas that affect you in terms of your productivity, your mental health, and all those things. So we have to really factor all those things in there. Of course, then COVID hit. It was a public health emergency. It threatened our security. It threatened our lives. There was a need for rapid medical countermeasures. Those are the vaccines, the therapeutics, and we're still trying to get all of those. We have the vaccines, fortunately, but there are also other therapies that are coming online. But what else are we doing? Those public health measures. So what can you do to protect yourself this holiday? When you know, this is a typical time where everybody travels back home. You want to go see your family, your relatives, they're saying come, but you may have a diagnosis or an underlying chronic medical condition that puts you at risk. So you have to balance that. Nothing is 100% safe, nothing, even walking across the street. God forbid, somebody can be hit by a car or something can happen. So we have to really balance our risk tolerance. Is it really worth it for me to travel back home when I have this underlying diagnosis and I'm not doing well? Or maybe I really need to go because my mother is sick and I need to go see her. What am I going to do? Did I get vaccinated? Am I wearing my mask? Am I social distancing at best? Am I trying to reduce my risk? Those are the things we really have to think about as we're trying to plan that. There's certain things that aren't worth it. There's certain things that are worth it. You have to make that decision, but you have to balance the risk. Is it the risk of me getting sick and being hospitalized? How's my medical condition? What does my doctor say? What does my family say? Those types of things we really have to balance. With regards to COVID, COVID magnified a lot of things. We saw more fear, more distrust. We saw the health disparities, as I mentioned, but it brought out a different side of everyone. So you got to see what was important and what was not as important, at least by our eyes. Also, it affected people's mental health, your well-being. Your mental health affects also your immune system, right? If you're sad, depressed, down, and all those things, it can affect your immune response. Even with the vaccine, you have to make sure you're also taking care of yourself, right? You're doing things to support your immune system. Stress relief, laughter, happiness, not putting yourself at risk, and not dealing with other things that are not good for your mental health. Those are all important pieces to your immune system. So when you have an underlying diagnosis or you're a survivor, breast cancer survivor, whatever, you have survived, you've been through it, and it can be very challenging. Doesn't mean you have to always be sheltered, but you also understand that there's some delicacy to this process. So again, risk tolerance is one of the issues that you have to really figure out. Again, I talked about also misinformation, right? Finding your source, getting accurate information. Talk to your doctor, your healthcare provider, the one who you trust. Make sure they know what they're talking about. You can always get 2, 3, 4 different opinions. Do not ever feel shy to ask your doctor a question. That's their job. And that's what your insurance or you are paying them for. So you have that right. And you can get a second opinion, third opinion. Any doctor who challenges you or healthcare provider on getting a second or third opinion, they really either have something to hide or don't have confidence in what they're doing or don't look out for the best of you. Because if they are, they'll be more than willing for you to get another opinion. It doesn't mean they don't know what they're doing. It means that you, as a patient, wanted to advocate for yourself. And it's very important in this day and age to advocate for yourself. I think there's also importance about culturally competent communications, the CCC, which is important about how we discuss these things among each other, right? So it's different in the African community versus the African-American community versus the Caribbean community versus the Native American community versus the Hispanic, Latinx community, the Asian community. I mean, very different approaches to things, but there are some common threads. One, they either know the person or the messenger is from their culture. They're able to have a candid, frank discussion with them. And then they're able to get accurate information. And in those cases, you have to also understand what's unique to those cultures. What is a pressure point? Because you become relevant for that culture. And that's how you start to address some of the misinformation and also giving them a place for them to congregate and ask questions, just like this forum we're having. And it's important to have organizations, the federal government, such as the CDC and others who are part of this process, trying to reach out into the community. And there's a program they have, Reach, that reaches out into the community. And just along with your program here and the organization, the funding is towards educating our population and addressing those health disparities, and also trying to improve their health outcomes. So after surviving cancer or surviving a chronic disease, diabetes, hypertension, renal disease, you name it, to be able to have that resource. So that's why you're here. So what other things are important? People want to travel, they want to go back home. So how should you travel, or how should you address being back home? I would say the most important thing would be, one, understanding your risk, making sure you've planned ahead. We're usually last minute, but you have to really plan ahead. So be that getting all your vaccines and being prepared for all the things that you normally would do before you go to a certain area, your malaria pills and all those things, very important. Then I think there's another important piece. It's something taboo that we don't talk about, which is basically succession planning and even having a will. You know, nothing is guaranteed. Those are things that people don't ever want to talk about. Don't talk about this. Or, you know, that's not what we're talking about. It's very important in the culture to break those norms where we talk about it. It doesn't mean we're wishing for something bad. It just means we're preparing, and also making sure you're not passing on a legacy of debt. That's another thing. To your children or to your little ones or your family members, because you've made a plan, an estate planning. So it's important to think about these things. I know it's not very popular, but it's very important, because when it comes down to it, especially when you see me in the emergency department, God forbid if something's going down and family are coming in and something didn't work out right, that is not the place for you to be fighting and arguing with your sister and brother. No, mom would want us to do this. No, mom wouldn't want us to do this. You guys should have had this discussion a long time ago in advance, God forbid if something were to happen. But you also have social workers to be able to discuss those things. So succession planning, very important. When you're making this travel and trip, of course, we talked about the vaccinations, but more so now I want to talk about COVID and Omicron. Get your COVID vaccine. Make sure you talk to your doctor. Of course, this is for informational purposes. I'm not your doctor, but I want to also share the accurate information for you. So far, your two shots of your mRNA vaccines, and there's one of a J&J. Their risk with some of these, we've shared those. Nothing is 100%, but the prevention from hospitalization and death is key here. I want to highlight, most importantly, how vaccines work. So contrary to popular belief, people believe the vaccine is just this protective shield that just protects you from everything. It's not a force field. It is not a shield that just blocks everything. It is partially an armor that you can wear to protect you from the worst case scenarios. And those worst case scenarios are you seeing me in the emergency department and me having to put a tube down your throat to help you breathe, or sending you to the ICU. If you're not doing all of that, you're good. Yes, there are people who will have positive tests and things like that. And some people are asymptomatic. They don't have any disease or anything like that. And that's okay. We don't want anybody to get any infections, but if you do, as long as you're able to survive and pass on your legacy and be around for your family and loved ones, I think that's a big deal. So the vaccines are doing what they're supposed to do. They're supposed to train your immune system to help you fight. And if you're in a state where you have a low immune response because of your underlying medical condition, it is definitely even more important to make sure you're vaccinated. So please consider getting your boosters. We've been talking about that. That's something that's been shared around. After 6 months of your primary series, it is time to get your booster. The data is showing that, especially for this Omicron variant, it is very important to have a robust immune response. Of course, there are T cells and B cells and other cells that help you fight infection in addition, but training your immune system with the vaccine and the booster, that is key and important. So I would definitely emphasize that. I think also with travel, knowing where you're going. is important. So is it a big house, family population? Is it where you all are congregating so much? Do you know the status of the people? Are they getting tested? The logistics back home is totally different from the logistics here, and how they have access to vaccines. If they do, that's great. But if they don't, then that social distance is very important, and the masking. So, and the strict hand washing. So you're going to have to be doing all of that and do it religiously to protect yourself. Again, I told you, if you're at significant risk, you may want to talk with your doctor and have this conversation. Is it really worth it traveling back home, or maybe staying where you are and spending time with your local family who's been living with you? And if it's where you're going to greet people or see people during the Christmas and the holidays, there's a cultural norm about all of us congregating. However, during these circumstances, the risk benefit, again, you have to consider on your own. It is recommended that you not be in social settings where you're congregating or being at risk. You should be masking, social distancing, and hand washing. So do all those things. We all know this. We've been doing public health for years, even before this became an issue. So I think people can understand that, and we do tend to follow rules, or we've been in countries or situations where the rules are the rules and you just have to follow them. But in America, we have our civil liberties. So I think that's been part of the thing that has also somewhat kept us back in terms of our overall responses. I was looking at the statistics, even just from Ghana, looking at the number of people who have died from disease, very low number. The dwarfs what we're experiencing in the States here. But that's because they're following all the public health measures and doing those things, not just because of the population size, but they're actually adhering to it. And it's not because they have more vaccines than anybody. It's just they're doing the public health measures that have been true, tried, and tested. Safety is important. I think it is important for us to figure out how we balance our risk and also share that with our people that we're seeing in terms of our relatives and our loved ones, and let them understand the risks that are involved in that to be able to address that. I wanted to also mention another thing, which is pretty much of what is a successful program looking like. So for this wonderful organization, what is success for you? It's time for you also to reflect on what would be successful for your audience, for your population, for your people. Success is if we're living the life. So we look at things such as life years saved or lives saved. I think we can look at both, meaning we have a longer life that we're living, even with scary diagnoses or underlying medical conditions that put us at risk. Are we improving? What are we doing to make ourselves better? What that success looks like. So I think that's one of the metrics that we should look at in terms of success. And then also in disease, what are we doing to curb the disease, the number of cases in terms of relapse? And are you eating healthy? There's certain foods that we eat that may not necessarily be good for our health. And people may get offended by this, but I love my pounded yam, I love my fufu, I love my egusi, I love all my stuff. But also I have to say, in moderation for certain things, I will not be having that because I have to make sure either my cholesterol level or my blood pressure is well maintained, or certain things, even diabetes and all those things. These are sometimes carbohydrate-based foods, which are sugars. They turn into fat, all those things. So we have to consider that in terms of our health. Are you on some special vitamins that help boost your immune system? Are you following the regimen of your doctor, ideally? And in an ideal situation, if we can get our healthcare system, it should be where we're able to actually prevent and diagnose cancers early on and other disease processes. So with the advent of mRNA technology, we're looking forward to actually having cures for diseases and addressing these things early on, but also it's about the environment and the food and all the things also that put us also at risk. So we're trying to reduce all those things by preventing the risk. I think we've covered all the main things I wanted to cover. So we've covered everything from safety, risk tolerance, understanding how important it is for us to get our vaccine and the booster, especially in the wake of Omicron. Literally, it's spreading throughout all, and I can give an overview of what that is doing in the nation and what we're seeing in the emergency departments. But the thing is, what are you going to do? How practical is it for you? What your risks are? Are you traveling back home? Are you traveling in the States? Are you actually meeting up with family? Are you congregating with others? what is your risk? What is your risk tolerance? Have you had this conversation with your doc? Have you done estate planning? Many questions, which I tried to answer for you, but I think you need to start thinking about those if you haven't. This is a time of the year also where we want to make sure we're risk averse, because this is usually a time of the people we also see a lot of people die or pass away due to other people's mistakes or indiscretion. So be careful and be safe out there. I think that's an important message. Those are the things I would say I would highlight, Ms. Iffy and Chris. I appreciate you all for having me. I'm glad to take some questions. I want to quickly summarize Omicron, and then I'll take some more questions or any concerns that you want to talk about. Most importantly, Omicron is now here, so it doesn't matter how you call it, Omicron, or whatever. It doesn't matter. It's a virus that doesn't respect anything, and it's spreading faster than Delta right now. Delta still is the dominant one, for which you should have gotten your sets of vaccines to help you with that. But we recommend a booster right now because of Omicron. Omicron seems to, in some cases, there was a preprint study, recent research, that shows that it acquired some characteristics of the cold virus. So basically, it's mixing with other virus, and now it's even more contagious, right? And spreads, but it doesn't seem like it's as serious. But that's only for right now. We don't know the long-term effects, long COVID or other things, or will it evolve? And I think as we get more and more variants, which will continue, we're still at risk, and God forbid that we get one that even doesn't respond to any of the immune responses. So we have to really be careful. If you don't need to acquire it, try not to. So all I'm saying is wear your mask properly, follow the public health measures, and be safe out there. And for our children, because people also wanted to know about the kids and things like that, vaccines are out for them. I would recommend it for you. I have 3 kids. They all got their vaccines. So I think it is important because we want to protect them. And remember, they're all coming back from school, literally from college. They just finished their finals. They're all coming back for the holidays, and they'll be mixing. And they might not necessarily follow all the rules. So you have to make sure that they're at least masking within the house, or at least vaccinated and protecting themselves. So we have to emphasize that for the young population who tends to be or feel that they're invincible and not at risk. And so they don't put their grandparents, their aunties, uncles, relatives at risk while they're being home. That's pretty much what I have for you today, without boring you all to death, but I tried to highlight the most important things with regards to travel safety, with regards to having a chronic medical condition that puts you at risk, with regards to recognizing the African diaspora and our culture and our different cultures, and also how we have to navigate around those things and identifying your own risk, but also trying to prevent certain things from happening in that case. And most specifically, we're talking about COVID. I'm done.
Thank you.
Go ahead, Ms. Iffy. Go ahead.
Now, I was just gonna say thank you very much for that. You were real candid and touched up on all the things I know we as a community do. So we really appreciate that. And we ask if people have burning questions that would he can help us answer. This is the time to do that.
Yep.
Great. So while we wait for questions, if you want to put them on the chat box, that's fine. Or the Q&A. Okay, yeah, great. I have someone. He or she said, can you explain how the immune system works with the vaccine?
Sure. I'm not an immunologist, so I'll put that out there. I'm an emergency physician, but I did study enough about this. And I did work in the biodefense world, so I do know a good amount about this. With the vaccine, the best way to describe it is, let me see, I can do it a couple of ways. I'll do what we call the bank teller mode, and I'm specifically talking about the mRNA vaccines. So the mRNA vaccine basically is this vaccine that has instructions. It gives instructions to your body cell to produce a spike protein, and then make antibodies to it. What does that mean in English? If you imagine you going to a bank teller, and you go to the bank teller and you say, hey, I need to get this withdrawal. I want to take some money out of my account. You write some instructions, you give it to the bank teller. Your instructions is the mRNA. That's the vaccine that's being injected into your body. As your body then receives that instruction, or the bank teller receives the deposit withdrawal information, bank teller looks at it, goes into their computer system and maybe into their drawer and takes some money out and gives that to you. The same way your body then receives this mRNA instruction. It goes into the cell. It doesn't go into your nucleus, which is where your DNA is, because a lot of people were thinking it's going to affect their DNA. That's not the case. I would liken your DNA nucleus as the safe in the bank. You know, when you go to the bank, you don't see the safe. Safe is somewhere else where they don't want you to see, because that's where all the money really is. So that's what the nucleus is, and that's not what it's touching. So your cells then make these spike proteins, which are just little pieces of the protein, a description of the key for which the virus uses to enter the cell. And it makes a copy of that. And then your body then says, what are these cells? These spike proteins. Or in this case, you've received the deposit from your withdrawal from the bank, and now you have your cash in hand. So your cell now sees these spike proteins and makes antibodies to them, so that the next time when your body sees this suspect or this spike protein or this money which you received, your body would then respond and say, oh, I remember recognizing this. Let's fight to protect ourselves. So the way it basically works is it stimulates your body to make antibody cells or fighters, police cells or army cells, to fight when they see the suspect, a description of the suspect, which is the spike protein. Hey, I see he has a black hat on, white shoes, green shirt, and blue pants, and about this height. So you have a good description of it. And that's what your body does. There are other things that go in the background. Notice I'm only talking about antibodies, but there are T cells and B cells that also recognize different parts of the virus and then attack and fight that. So that's the best way I can explain it for you.
Awesome, thank you, Doctor. So if you have more questions, you can actually unmute yourself to ask, or you can, put it on the Q&A session of the chat box, and then we can actually ask. So while we wait for questions, Doctor, I think that it's important that, we also talk about safety measures in terms of traveling, maybe local travels or international travels. In between that period, what is expected of us, while we're traveling? Maybe we're traveling with a group of people and we probably don't know their vaccination status. How do we manage that?
Yeah, so I kind of alluded to this earlier. I think more specifically for folks, if you're going on a flight, and I have a couple of articles that are published if you want to go to, I think it's called National Geographic. There's an article on travel, and you can Google my last name with it, Fagbuyi, and you will find the article that talks about traveling. There's another one in Essence magazine also where I talk about traveling and in health news. But anyway, the bottom line things are when you're going to travel, you're going to wear your mask. I prefer a N95 mask if you have one. If you don't, a surgical mask is fine. Maybe you get 2 layered masks. If you're going on a trip, you should have hand sanitizer, of course, or some way to keep your hands clean. If you can avoid eating on the plane, avoid eating on the plane. But if you're going to just, temporarily pull your mask down, eat and do your stuff. Within the group, as you're going in a group, it doesn't matter, local or international travel, you're mixing with people. You're with people online. You're with people as you're going through your queue and you're looking at your documents and things like that. All these are at-risk times. The air may not be circulating as well in the airports and in the area as opposed to in the plane. In the plane, actually, it may be even greater. So you have more cycles of air circulating. So you actually have lesser risk of virus transmission. There have been many studies that have looked at that. over the past year since the pandemic, because they were questioning whether you can get things on the air flight. So the filter system, once the plane is on and the air circulating, good. When it's not on and people are, moving through and putting their stuff up in the cabins, and those are risky times. Make sure you have your mask on and try to distance as best as you can. But the safety measures haven't changed. The public health measures that have been for years, over 100 years, the worst pandemic of 1918. Well, guess what they did? They had masks, social distancing, washing their hands. That was what was working. They didn't have all the vaccines at the time. So now we have the vaccines, but guess what? This is the vaccines, and those same public health measures for over a century still work. So that's what I would emphasize. And when you're doing international travel, there are expectations of testing, right? Before you get to the plane. So make sure you know what the testing guidelines are for the city, state, country you're going to. You have to check with the airlines way in advance. Some want 72 hours of a negative test, PCR, the one where they stick up your nose and do the test. Or some want within 24 hours. So you have to know where you're going and then what it is and the expectation. And some want to see your vaccine card. Some organizations also have health passes where you electronically answer the question on your phone. It shows, hey, I'm green, I'm good. I can travel, I have been vaccinated, those types of things. So make sure you have all of that. You should have copies of your vaccine card. I would even take a picture of it and also put it on your phone. So now you have a digital picture of it and you have the vaccine card itself, because you don't want to lose it. If you lose it, it's like gold, you just lost it. So please make sure you take copies of it. Some will laminate it, you put it in a special protective covering and casing, so you have that also with you. You should, of course, have your passport. Make sure you take a copy of that. Make sure you also take a picture of that and have an extra copy of your passport. God forbid if you lose your passport and things like that. Know where the embassy is, how you can reach the embassy folks. These are all important rules when you're traveling. And when you're traveling in groups, you want to stay and stick together, especially if you have kids or young kids, or if you have your teens or kids who are traveling, because we also have human traffickers, people who kidnap kids during these times. You have to be very careful and be very vigilant of what's going on. But the testing before and after will be part of the plan, and be prepared for all of that. Have your vaccine card and all those things in addition to your masking. Some people wear goggles. I don't know that you necessarily need to do the goggles thing, but it's definitely the masking, social distance, hand washing. You can wipe your surfaces down if you're very much a neat freak like some people, but I'm good with just washing my hands and hand sanitizing and wearing my mask, not talking pretty much throughout the flight. But remember, there's some long flights where you need to stretch. Also, you need to get up. If you're in a state where your body tends to clot, or if you are someone who's recently diagnosed with cancer or other things like that, you have what we call a hypercoagulable state where you can actually get clots. So you want to make sure you're able to get up and move in the cabin so you can stretch and circulate the blood through your legs. You don't get any clots. These are all risks that we have to factor. With your mask on, also trying to social distance. It's not easy. So there are risks. This is why I said we have to really consider, is it really worth it for me to travel or not? And what's the risk that is inherent with that? So those are the things people have to make. They're individual decisions that you have to make. No one can prescribe it for you.
Thank you very much.
It sounds like there's some questions in the chat.
No.
Yeah, I see a question that says, my youngest daughter and my son's wife have refused to get their vaccination. Reason being that their spouses had their vaccinations but recently tested positive after a family Thanksgiving get together. It says, why take the vaccine if you can still get the virus? How do I convince these kids to get the vaccination? Excellent question. I get this all the time. And I said this in the beginning of my presentation, that the vaccine is not a force field. It is pretty much like a shield. So it's not bulletproof. I mean, the job is to prevent you from coming into the hospital and getting a tube down your throat, where we will call intubation, where we put a tube, literally close your mouth and we put a tube all the way down your throat, connecting to the pipes of your lungs to help you breathe, and send you to the ICU. That's bad. If you're not going through that process, you may have some body aches, chills, fever, almost like malaria, almost like the flu, and you have those symptoms and a positive test, or some will have a positive test and they don't have any symptoms. You're doing fine from my perspective. That doesn't mean we ought to talk about the long COVID and all the other things or the other risks, but for now, at least for here and now, that you're alive, breathing, doing your functional thing and being around family and not in the hospital, that's good news. Nothing is perfect. And I think that's what people have been anticipating. There was a joke on the internet about people thinking the vaccine was going to give them superpowers or make them this invincible individual. That's not what it is. It doesn't give you superpowers, but it does protect you from coming to see me in the ER and seeing any of my colleagues. I don't want to see you. No hard feelings. That's just where it is. So I would say that's important. So that's a great question. Somebody also asked another question in the chat, which says, how can we deal with so many conspiracy theories that flood our social media outlets, especially our ethnic groups, especially anti-vaxxers who put out many videos, how even the vaccine virus is still, vaccines, how even with the vaccines, the virus is still spreading, and how do we mitigate these challenges? It's not easy. I've been fighting misinformation and disinformation on Clubhouse, on Instagram, on Twitter, where else? On the regular media outlets and different. You can check my IG on that and others. But the point is, you have to have the right messenger, and you can only do but so much. People are going to believe what they're going to believe. They're going to do what they want to do. Spend your time talking to the people who are on the fence. Those your loved ones. Give your own story. That's all you can do. And people will make their own decision. You can't really force people to do certain things. You can lead a horse to water. You can't make it drink. It's just what it is. But we have to put the right information out there in front of them, making sure they know the right source and information and sharing with them. The vaccine is not supposed to be 100% bulletproof. That's the story. Maybe that information wasn't shared by public health initially. We as communicators didn't do a good job sharing that. But the message is out there, and yours truly has been saying it, as many of my other colleagues have been, that it is not a force field. So you don't get superpowers just from getting the vaccine. It does protect you and help spare your life, but that doesn't mean you won't get a positive test. We're trying to get better with the science, but it's a dynamic of change. What we know today, we tell you, and what we don't know, we tell you we don't know. So yes, there will be positive cases of tests, but positive case of test doesn't mean death. It doesn't mean hospitalization. So when you look at the grand scheme of things, they're still working and doing what they're doing. So that was a question in the chat. I don't know if there are any other questions. I don't see any other questions in the chat. Chris, are you still there?
Yes, I am. I was going to ask a question. Now that we're talking about vaccination, I think it's very important that we also try to see how we can demystify some of this myth, around the vaccines and all of that. One of the things that, as we try to, develop culturally competent communication materials online, for our community, some of the questions that crop up around vaccination is something like, the messenger RNA technology, used to develop the COVID-19 vaccine is actually brand new. So how come they were able to just quickly develop something so quickly? It was as if they were preparing or they planned for this and, they are just putting it out there. So what can you say about that?
Yeah, thank you. Great question. I have a top 10 greatest hits of conspiracy theories, which I've combated in all these different social media outlets. So that's like the bread and butter, the number one go-to. No, we haven't. Nobody was planning for it to happen. Were we preparing for any of these things to happen? Yes, that's what our job was. Public health. You're supposed to lead. You don't just react when something happens. You should be able to think ahead of time. So you can't fault people for thinking and saying, oh, what if this happens? What if this happens? We have to consider every single scenario as best as we can. And that was our job. So yes, people have been thinking about this, but they weren't planning for it because they knew they were going to release it. That's a conspiracy theory. That wasn't the plan. Now, could there have been terrorist attack where they would want to release biological weapons and things like that, such as anthrax? Yes, I actually was the chairman of that vaccine work group where we were starting to plan and prepare. If we get hit by, at some event, you're at a football game and some terrorists release anthrax to the population, what are we going to do? Are we going to be like, oh my God, something has happened? No, we're supposed to prepare and figure out what it is. That's our job. to say, hey, this is how we're going to take care of the public, the children, the elderly, and all those things. So we did those types of things. So same thing for pandemic influenza. What are we going to do? How are we going to get some beds? How are we going to provide information to the public? Are we going to tell them everything? Yes, we should tell them everything so they know what to do. Is it going to cause panic? All these things we have to figure out and do. So we did all those things. So to the question about the mRNA technology, mRNA has been around for almost 20 years, literally. They just haven't been able to get it to perfect it right. I mean, they've been looked at it with HIV, with cancer, and all those things prior. So they've had data. It's been actually a little bit over 15 years of data looking at that. So how were they able to rapidly get everything to work, so to speak? Well, there were a lot of things going in. One, this was the biggest virus by all means, and by all accounts possible, all eyes were on this virus and this pandemic. So that's one. Lots of money were thrown at this whole process. Literally, the whole world is shut down, right? So all the money went to this focus. This is probably the most scrutinized vaccines and whole process in the world ever, literally, based on the pandemic. So that's when we kind of like chuckle, like, really? This is the most scrutinized one, but yeah, you're the same one that's going to take the blue pill from Pfizer for your special needs, for your impotence and dysfunction, but you want to complain about the vaccine here. You're the same one that's going to take this herb from another food store that you don't know how they made it. For all we know, it's sand mixed with sugar, and they made it and packaged it. It wasn't FDA approved, and you're swallowing it and saying, oh, it gives me energy and vitality. Please, get real, people. Like, literally. So these conspiracy things, they just make us sometimes laugh, but it's sad because people's lives are at risk. The other part with regards to that, so yes, they threw all the money at this, but also all the red tape, the whole bureaucracy process. It goes to this department, takes 3 or 4 weeks to get to this department, takes another 4 weeks to get to this department. Oh, well, we don't know if we have the budget for this. You know, all the excuses and the red tape, the BS, as we call it, was cut out of there. So we were able to streamline all of this. Everybody's working, scientists from all over the world working together, collaborating, sharing information. So they were able to get the sequence of what this virus looks like and share it with the world. So that's how we got here. If it weren't for all of that, yeah, it would take a longer period of time. Typically, most vaccine production and development can take anywhere from 3 to 7 years. You're totally right. So we were able to get this in a short period of time. But also, don't forget, we also had Ebola, and we had MERS, and the SARS part 1, SARS disease, the first one in 2003. So we had been getting some ideas of what these coronaviruses look like, and also have been using this mRNA trying to figure out the vaccine and what we would use. And they actually had an Ebola vaccine now that's been out. So all those data were kind of compiled up to get all this information in record time. I hope that helps. Even when people have their conspiracies, they're still going to believe what they want to believe. But this is the most scrutinized vaccine process ever.
Thank you very much. I think you've actually given a lot of light, on this particular topic. I think what we're going to also do is just to see how we can even just cut out this session and, share it on social media for people to get this detail. I have one more question. I think this will be the last question for today. For those traveling to the continent, for the holidays, access to medical care is not very reliable. What will one do if they contract the virus to help increase their survival chances?
Oh man, this is a big dilemma. This is like, I'm just going to say it, and I'm very blunt about things. I don't know what to tell you. I literally don't. It is a risk tolerance. This has been the holy grail. This is the reason why I've been, and I'll be vulnerable here and share my own story. When we have relatives, I had my aunt who recently passed away of leukemia. And she's my mother's oldest sister. Love her to death. During COVID, this time, it was around October last year, she was sick, and like she's weak and she's tired and all. I'm like, oh, let's check her out, send her to the doctors back home, make sure they take a look at her, evaluate her, and do all these things. They did all that. Of course, it costs an arm and a leg for all of that. So we all, rally around, come up with the money to send back home to be able to get all these things done. We get all these things done. They say, oh, they see, leukemic cells in there and she's anemic and yada, yada, yada. Her platelets are low. She's going to need transfusion, blood. You all know this stuff. Bottom line, I'm like, oh, well, we need to get her to the States here so, she can see some specialists and we can do all the things. And I can have some say in what's going on and be able to have some visibility on the situation as a doctor, right? Because it's personal. Unfortunately, the whole process to get a visa, to get you over here, to do all that, even with all the resources and money and connects, it's a difficult process. And then with COVID, all that was shut down. And it was kind of like, oh, okay, we can't even get you here. Or if you want to go see them, they can't come over and all this thing. So it's a logistical nightmare. And it is my fear. And so unfortunately, she passed away and, we had to accept what we accepted. Even to go visit her or to have the daughter come over was even a challenging part of time at the time when they had travel restrictions. Of course, those have since then been lifted, but those were the challenges during COVID. I don't know what's going to happen with Omicron. I don't know if travel guidelines may change. Some have already changed that we've talked about, but could it be more restrictive in certain places? It depends on which country you're in, what their rules are. It's not just they don't all follow a specific rule. It's, public health rule, but also some may have their own health policy. So we have to respect their sovereignty and their decision making. So I can't tell you what they're going to. It depends on where you're going. Try to find out. But remember, it also changes. If they get new information and they say we're shutting down everywhere, nobody's going anywhere, those are risks. Again, it goes back to the risk. What risk are you willing to take? Can you be stuck somewhere? And if you get sick, do you have access to your specialist? Yeah, you can call them. You can call them in the States or wherever you are. But is the other doctor one going to even listen to them? Can you even get to the facility? How is transportation? All these things that haven't been put together in our systems back home. Our healthcare system is not secure. It's not up to par. Even in the States, it's not up to par. We're trying to get it better. But you understand what I'm saying? The logistical nightmare back there to an unknown area or a place you haven't visited in a while, or that there's a kink in the system. I don't understand, though. You have to make sure you know your own risk. I beg.
Yeah, I think it's important to communicate it that way, so we really understand the gravity of what
I mean, it's serious. I don't support it. It's just unfortunate. We don't have the logistics there. So no, if I have someone who's at risk and who has a disease that I'm worried about and their care, I'm not sending them back home right now. Not during this time. This is a time where everybody's mixing, everybody's going home, and then the burden on the healthcare system will be even higher. So yeah, no, that's a setup for failure. My personal opinion, but maybe somebody has access to a private hospital, private jet, billionaire. I'm not that guy. So we can't do that.
Awesome. Okay, so this would be our final question because we're already at 12:30. Yeah. We have Carla raising up her hand. Carla, so you can go ahead and ask your question. Carla Ennis, are you still there? Can see you're raising up your hands.
Yeah.
Okay. Looks like she's not, Okay, yeah, I can see a question drop. Oh, I didn't mean to do that. That's fine. All right. Okay, so thank you very much, Dr. for this session. Ms. Ife, I think you would take over from here and then we can, yeah.
Okay, thank you so very much, Dr. Dan. I truly and thoroughly enjoyed it. I have had a few people texting me they enjoyed this very frank discussion and education. So I think you got yourself in a little trouble, but it's good trouble.
We like good trouble.
Good trouble. meaning we're gonna hopefully invite you back before the end of this brand, so
okay.
We can talk some more. We really, really enjoyed it. We can ask for more. So all I can say is thank you for honoring this invitation. And for everybody who is out there listening, we wish you a very healthy, joyful holiday season. Hopefully next year we all can come back together and continue the discussion. So thank you all very much.
All right, God's grace. Thank you all very much too. And be safe out there. Please get vaccinated, get tested, protect yourself, protect your family. And also definitely take the moment to appreciate what God has given you right now, the life and the breath of fresh air, and be able to bless others with that, and be safe. Thank you so much.
Thank you.
Thank you everyone for joining. Let's keep safe while we're at the holiday. And then for next year, we'll have another episode. By January, towards the end of January, we'll have another webinar series, February, March, and April. So let's stay connected. And thank you everyone, and have a good afternoon.
Thank you.